What's up? I'm Hutch, and you need to understand vestibular conditions so that you can better treat your patients and also pass the NPTE. In this video, I'm mainly talking about peripheral conditions. Central conditions like strokes, TBIs, brain tumors, things like that are going to be a lot more complicated, and so I'll do other videos to kind of cover those. Peripheral conditions are also a lot easier to treat in the clinic, and I've already covered BPPV, so check out this other video if you want to learn about that. Unilateral vestibular hypofunction is basically an umbrella term meaning that one side is weaker than the other, and this can include peripheral or central conditions. One common type is Meniere's disease. This can occur when there's a disruption to the sodium-potassium ion pumps. This can cause vestibular nerve palsy since it doesn't receive the right amount of nourishment from that endolymph. There are 3 hallmark symptoms of Meniere's disease, including long bouts of severe vertigo, hearing loss, and tinnitus, which is typically a ringing in the ears, but can often be described as a roaring in the ears with Meniere's disease as well. Treatment can include meds, dietary changes, and adaptation exercises. Another common type of unilateral hypofunction is vestibular neuritis or labyrinthitis. Basically, you get a virus that causes inflammation somewhere in the inner ear and it messes you up. Symptoms can include severe vertigo, nystagmus towards the intact side, and symptoms that may resolve within 48 hours due to central compensation. Treatment can include caffeine as well as vestibular and postural exercises. Now, another category of vestibular conditions is bilateral vestibular hypofunction, meaning that both sides are weaker. And again, this can be central or peripheral. The most common peripheral type is ototoxicity. This happens when meds like gentamicin target and destroy the vestibular system. This causes oscillopsia, repeated falls, and can make the patient really afraid to go out in public, causing them to self-isolate. Treatment can include safety awareness training, vestibular balance and reaction training. There are a few other types of vestibular issues to be aware of, including perilymphatic fistula. This is where a change in pressure, like when you're diving or when you're flying on an airplane, causes the tympanic membrane to burst. You'll typically hear a pop, have positional vertigo, nystagmus, hearing loss, and Tullio sign, which is when a certain decibel will replicate their symptoms. Now, this can only be solved via surgery with quite a few days of bed rest after. An acoustic neuroma is a tumor in the inner ear that compresses on the vestibulocochlear nerve. This can cause dizziness, hearing loss, and poor balance. Surgery or radiation can help reduce the tumor size and the pressure on that nerve, and PT can then help recover from the deficits. Finally, Barquement syndrome is when your body gets accustomed to the balance of being on a boat, and then when you get back on land, you feel this sense of disequilibrium. Adaptation can help reduce those symptoms. Now it's time for NPTE Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. This is really important to remember for the NPTE. Nerve palsy in the inner ear can cause really severe symptoms, but they are easily recognized. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes on Etsy, or drop me a comment with questions or suggestions for videos I should do in the future. Otherwise, good luck studying. Go change the world.